name is Liz. And you're Mr. Johnson?
Yeah, you can call me Zach.
Zach, perfect. I'm going to be your nurse practitioner today. Have you ever met with a nurse practitioner before?
Nope.
So nurse practitioners are similar to doctors or physician assistants. We work as part of the healthcare team to diagnose, manage health conditions. We can order lab tests, prescribe medications, and also talk about any healthy habits that you'd like to work towards. Does that sound okay?
Sounds good.
Perfect. So my pronouns are she, her. Are there specific pronouns that you would like to use?
He or him.
He or him, okay. And you'd like to go by your first name, Zach?
Yep.
Okay. And Zach, what is your address?
123 Elm Road.
Okay. And what is your phone number?
815-123-4567.
Perfect. And what's your date of birth?
June 18th, 1986.
And how old would that make you?
36.
36. Okay. And what is your usual source of health care? Do you usually see a primary provider? Do you go more to the emergency room or immediate
I
care?
usually use my primary care physician or immediate care.
Okay. And are you assigned male? Do you go by?
Yep.
Okay. And what about your marital status? Are you married,
Married.
single, married? And what's your occupation?
Architect.
Architect. Okay, that's interesting. And you'll be providing your own health history today?
Yep.
You'll be answering the questions? Perfect. So are you here today just for a regular physical?
Yep.
Okay. When was the last time that you saw a healthcare provider?
It was probably 8 months ago.
8 months ago? Okay, and was that a full health visit, or was that for something specific?
It was for a prescription refill on an antidepressant medication.
Okay, perfect.
But as a part of that, he gave me like kind of a, I don't know if it was necessarily like a full health physical, but he did check some other random things that people
Okay.
my age might deal with.
Perfect, like some labs and
Yeah.
stuff like that. Okay. Do you have any, so you mentioned the antidepressant, do you have any other medical conditions that you see a healthcare provider for?
No, not specifically. The only other medication I guess I take is for frequent heartburn, but
Okay.
that's all.
Okay, so what about any high blood pressure, high cholesterol, diabetes?
I don't really, as far as like, I got labs drawn the last time I went to the doctor, and I had higher cholesterol. He wasn't concerned about it right now, but
Okay.
it was higher than it normally is.
Okay. I'm gonna put it outside. Just a second. Okay, come here. All right, sorry about that brief interruption. Have you ever been diagnosed with any thyroid conditions?
No.
Okay. So talked about the kind of borderline high cholesterol labs. That's definitely something we can look into. As far as the antidepressant, have you been diagnosed with anxiety then?
Yeah, general anxiety disorder and OCD.
Okay,
So,
all right. And then when was that first diagnosed?
2019,
2019. And what sort of treatment for that?
like at the time, or
Just currently?
I just take the antidepressant medication.
Okay, perfect. And then do you see any specialists for any other medical concerns, like an endocrinologist or?
Nope.
Okay, perfect. Are you concerned with your health or well-being at all?
Not specifically. Sometimes I feel like I could have better diet or fitness, but other than that, not
Okay.
really, no.
So overall, you might say that you're in good health?
Yes.
Okay. Are you concerned with any sort of disabilities?
Mm-mm.
Okay. So I know it's kind of hard to keep track of all of our immunizations because we've been getting them for such a long time. As far as you know, are you up to date on your immunizations?
Yeah.
Okay. And did you receive a flu shot
No.
recently? No flu shot. Have you ever been vaccinated for pneumonia?
Oh, no.
No.
I
And
don't-
then
I don't know.
you probably remember. And then what about COVID? Have you been vaccinated for COVID?
Yeah.
When was your I guess at this point we've had so many boosters. When was the most recent booster?
I believe it was in December or November
December of 2022?
22, yeah.
Okay. Perfect. And then, do you happen to remember when you have received your last tetanus shot? Usually it's something that
I
we
did.
get every 10 years.
Yeah, I think I got one actually, last time I saw my primary care physician.
Okay. And that was the
It was
8
like
months
8
ago?
months ago, yeah.
Okay. So, summer of 2020, maybe June?
Yeah.
Okay. And then have you ever had a TB skin test where
Yes.
when was the last time that you had that?
I got it, before I could do my football coaching at the current school I'm at, so it was probably 2 years ago,
2 years ago, so 20.
21 probably,
21.
yeah.
Okay. And was that negative?
Yeah.
Okay. And then what about a Tdap? So that's a vaccine against pertussis.
I don't
Do you
know.
recall that?
Mhm.
No? Okay. Have you had any recent exposure to any communicable diseases such as hepatitis B or tuberculosis?
No.
Okay. And when you do get vaccinated, do you have reactions to the vaccines at all?
Mm-mm.
Perfect. What about any allergies? Do you have any seasonal allergies?
Yeah, I do, like,
Like to
Pollen
grass? Pollen,
and-
okay.
yeah, grass, I think well, at one point I was allergic to dogs, but I
Okay.
don't think I am anymore.
Okay. And then what about any allergies to foods or medications? Environmental exposures?
Mm-mm.
And then some specific medications like sulfa antibiotics, any allergy, penicillin, and what about latex?
No.
No allergies to those. The seasonal allergies, do you just get kind of stuffed up and
Yep.
runny, watery
It's
eyes?
like a cold, kind of.
Yeah, yep, okay. So next we're gonna talk about hospitalizations and surgeries. Have you ever been hospitalized before?
Yes.
When were you hospitalized?
I was hospitalized in 2019.
2019, okay, and what was that
It was
for?
for depression.
Okay, and what was the outcome? You were just
Just-
discharged to?
Yeah, I was discharged and I just was on a medication and like therapy plan.
Okay, perfect. No other hospitalizations besides that?
What do you mean by like hospitalization?
Just like an inpatient stay,
Okay.
admitted to the hospital for any reason.
No.
Okay. Any surgeries, in the past that you've had?
Yeah, I
Alright,
had surgery on my nose,
when was that?
like 2012-ish.
2012?
No, it was like 10, I don't know,
Okay.
2010.
2010? A while ago.
Yeah.
And, besides the nose, any other surgeries?
No.
What about procedures? So something that could be done on an outpatient basis?
Like a vasectomy?
Sure, yep. Vasectomy. And when was that?
2019.
2019, okay. Have you had any recent visits to the emergency room?
In 2019.
2019.
Yeah, before I went to the
that.
hospital.
Okay, all right. What about any recent accidents or injuries or harmful exposures?
Nope.
Nothing like that? Okay, and then we kind of touched on medications, so what is the antidepressant that you're taking?
What is it specifically?
Yeah, the name.
Sertraline
Sertraline, and how often do you take that?
every day,
Every day, and do you know the dosage?
100 milligrams.
Okay, and do you frequently miss doses, or are you pretty
No,
consistent?
I take it every day.
Okay, and then along with the sertraline, any other medications that you take on a
Yeah,
daily?
just the frequent heartburn.
Okay, and what do you take for that?
I can't remember what it's called. It's a Prilosec.
Prilosec?
It's like the generic brand.
Oh, omeprazole,
Yeah.
maybe? Okay, and that's every day?
Yeah.
And do you know the dosage of that?
No.
Okay. What about any other over-the-counter medications?
Just like
Like a
Tylenol or
Tylenol.
ibuprofen if I need to, but
Just
no.
whenever that's needed.
Yeah.
No multivitamin, any sort of other vitamins or supplements.
Mm-mm.
What about any herbal home remedies? Do you participate in anything like that?
Mm-mm.
And then any sort of, do you take any medications that aren't prescribed to you?
No.
Okay, and have you ever used medication that has been prescribed to you in order to get high?
No.
Okay, perfect. Do you participate in any alternative therapies like massage, acupuncture,
Mm-mm.
chiropractic, aromatherapy, meditation, anything like that?
Nope.
Okay. So now we're going to go into a little bit about your family history. So I'll ask you some specific questions. And this will go up to your grandparents, so maternal and paternal grandparents. Are your paternal grandparents still alive?
No.
And then at what age did they pass away? Do you remember?
For my age, I wasn't born yet.
No, their age
Their
at the
age,
time when
yeah.
they passed away.
I don't know. I guess probably 60.
60s?
Yeah.
Okay. And do you know what was the cause of their passing?
Breast cancer and no, I don't know what
No.
my grandfather's
Okay.
was.
That's fine. And then what about maternal grandparents?
Are they alive
Yes.
right now? Yes. My
Okay.
grandma.
Grandma. And how old is your grandma?
She's like 90.
90. Okay. And your maternal grandfather, is he still alive?
No.
Okay. And when did he pass away? What age was he?
It just was probably late 80s.
Late 80s?
Yeah.
And what was the cause of his passing?
He had dementia, but I don't know if that was specifically what it was or what. But
Okay. And then are both your parents still alive?
Yeah.
How old are they?
My dad is 70. My mom is like 66.
Okay. And then what about siblings?
I have two brothers.
Two brothers,
Two
and
older
how old
brothers.
are they?
not 20, 39 and 38.
Okay. And then aunts and uncles on either side. We can start with your paternal side. Do you have any aunts and uncles?
Yep. I have two uncles that are alive still.
Okay.
Two passed away, and then an aunt.
Okay. And what did your uncles pass away from?
I think it was complications of alcoholism.
Okay. And then what about on your maternal side, aunts and uncles?
I got an aunt and an uncle.
Okay, and they're both still
Yeah.
alive? Perfect. I'm gonna go through, before I forget, what about your spouse? You said you were married?
Yeah.
And your spouse is alive?
Yep.
How old is your spouse?
33.
Okay, and children, do you have children?
Yeah, I have a 6-year-old and a 4-year-old.
Okay, perfect, and they're still doing great?
Yep.
Perfect. So I'm gonna go through just a couple of different medical conditions, and if you can think of any of your family members that we've discussed that you know of having any of these conditions, just let me know, okay?
Okay.
Allergies,
Yeah, but it's just like the seasonal allergy
the
type.
same sort
Yeah.
of, no family sort of history with any of the medication allergies that we
Mhm.
discussed, penicillin. What about asthma,
No.
arthritis?
Yes.
Who?
My dad.
Dad, okay. What about high blood pressure?
I don't think so. Maybe my
Okay.
parents. But
Okay.
I don't know.
Don't know for sure.
Yeah.
Okay. What about heart disease?
Yes. Both of my parents have had heart attacks.
Okay. And stroke?
This just goes to my grandma.
Yeah.
Aunts and uncles included.
Yes.
I think my uncle had a stroke.
On paternal side?
Yeah.
Okay. Any sort of other peripheral vascular diseases that you would know of?
Mm-mm.
Like any blood clots?
No.
Okay. What about diabetes?
No.
Cancer?
My grandmother on my dad's side.
Okay. You said the breast cancer.
Mm-hmm.
What about cystic fibrosis?
Mm-mm.
Any sort of gastrointestinal diseases,
Mm-mm.
like Crohn's disease or anything? What about gout?
No.
Any sort of kidney disorders?
Mm-mm.
What about sickle cell anemia?
No.
Any thyroid diseases?
Nope.
Any blood disorders, like trouble with blood clotting,
Nope.
bleeding? Okay. What about obesity?
No.
No. Any vision or hearing problems?
No.
No. what about any genetic or like birth defects?
Nope.
And then sudden infant death syndrome or SIDS?
Mm-mm.
Any neurological problems?
No.
Okay. Seizure disorders?
Mm-mm.
What about emotional problems?
No.
Okay. Learning disabilities?
No.
And then you did mention possible alcohol
Yeah.
issues with alcohol.
Mm-hmm.
Okay. And that was, you said paternal. Okay. Are there any other things that you are concerned about with your family history?
No.
Okay. All right. That's the end of that section. So, what's your current living arrangement?
I'm married and I live at home with my family.
Okay. And who makes up the family that you live with?
My wife and my kids.
Okay.
And my dogs.
Okay. And how's your relationship with those people that you live in with your
Good.
house with? You feel safe at
Mhm.
home and everything? Perfect. Are you satisfied with the relationships that are in your life currently?
Yep.
Good. And then you said you were an architect, so what's your work history?
Specific to like where I worked or
Or just the types of jobs that you've worked in?
just architecture jobs since college. Before
Okay.
that it was just random
Okay.
like minimum wage jobs.
Okay, sure. Are you ever exposed to any occupational risks, like chemical exposure or hazardous materials?
I mean, not specifically. If I was, I'd know about it ahead of time. But I go to job sites where there's active construction happening, so I
Okay.
gotta
And
Yeah,
how do you
careful.
protect yourself in those situations?
hard hat,
Okay.
high visibility vest, glasses, earplugs.
Okay, great. Are you ever exposed to violence on your job,
No,
at your job? And then have you ever needed to change your job for any health concerns?
no,
Okay. What is your perception of your finances? Are you worried about money or any sort of finances?
No.
Are you able to afford food
Yep.
and medications and all of that?
Mhm.
Okay, good. And do you have health insurance, dental insurance?
Yep.
Great. So what's the highest level of education that you've completed?
master's degree.
Master's degree. And what about your parents? What's the highest level?
I believe my mom has a master's degree.
Okay.
She definitely does.
Okay. And what about your dad?
But I think he's got an associate's.
Associate. Okay, perfect. Okay, now we're gonna kind of move into more of lifestyle sort of questions. Do you currently drink alcohol
Occasionally,
occasionally, like every week or every couple of weeks?
probably every couple weeks to like. Yeah, I'd say every couple weeks probably.
Okay. Perfect. Do you use any sort of recreational drugs?
No,
Okay, and that includes marijuana, even though it is legal in the state. Any sort of use
Nope.
of that? Okay, and then what about tobacco products? Any history of that?
no,
And that would include cigarettes, cigars, vaping, the chewing tobacco.
nope.
No history, good. And then caffeine also counts as a drug. Do you use caffeine?
Yes,
How often do you use caffeine?
I drink some soda every day.
How many sodas would you say?
I don't know, one.
One.
Yeah.
Okay. All right. And then sleep is really important. What would you say your sleep habits are like?
They're fine. I mean, I probably get 8 hours of sleep a night,
8 hours of sleep. Do you have
7 or 8
any
hours.
any difficulties with waking up at night or having nightmares, that sort of thing?
No, not really.
Okay. Do you do any sort of activity for exercise?
Probably not as much as I'd like to, but just walking.
Okay. How often would you say you do that?
Every couple days.
Couple days, and then is it for like a half an hour or what kind of ballpark time range? would
I'd
you
say cumulatively a half hour.
Okay, perfect. Is that something you'd like to increase then?
Yeah,
as
I should.
exercise? Okay. All right, and then just very basic. What does a typical day look like for you from the time you wake up to the time you go to bed?
It's pretty standard. I wake up, get ready, get the kids to school, go to work, come home, get the kids dinner, get the kids ready for bed,
Pretty standard
hang
every
out
day.
for a little bit, go to bed.
Okay. That sounds great. What about a typical day of eating? What sort of foods do you eat during the day? What are your patterns with eating and fluid intake, like water?
I don't eat breakfast. I usually don't eat at all until noon,
Okay.
roughly, and then I eat lunch. Probably don't eat again until dinner.
Okay. What would you typically eat for lunch?
Depends. Usually go out for lunch,
Okay.
so it just depends. I don't know.
Just depends on the day.
Yeah.
Okay. And then what about dinner? What's a typical dinner like?
Whatever HelloFresh we have.
Fair enough. Do you drink water throughout the day?
Yeah.
Okay. And is that kind of a standard throughout the week? That's kind of how much,
Yep.
what your eating habits are like. Do you follow any special dietary practices?
Mm-mm.
Is there any reason behind not eating breakfast, or that's just what you've always done?
That's just how I've always done it.
Okay. And then next we'll talk about stress. Do you feel like you have a lot of stress in your life?
No, especially after I take medication to handle it. So like before that, maybe I would say yes, but
Mhm.
no. Ever since I've been on medication, I don't get stressed about really anything.
Okay. So like 1 to 10, what would you give your stress on average?
Like 10 high stress.
Yes.
Like a 3.
Okay, good. When you are stressed, what sort of things cause stress? Work, family, children,
All of the above.
all of the above. And are there any ways that you cope with stress?
No, not specifically.
Okay. Do you currently see anyone to work through stress? Clergy or a mental health provider?
No, I did see a therapist for a little while,
Okay.
but no, I don't anymore.
Okay. And then we kind of already touched on this earlier, but have you or any of your family ever been exposed to violence?
Nope.
Okay, or any sort of abuse?
Mm-mm.
And you said you feel safe in your home and at your workplace?
Yeah.
Okay. Do you feel as though you've kind of achieved what you would have hoped for at this point in your life?
Yep.
Okay. And then just kind of talking about some safety practices. So you practice safety at your job. Do you wear a seatbelt when you drive?
Yep.
And when you're a passenger as well?
Mm-hmm.
Do you bike at all?
No.
Okay. Are there any other safety measures that you can think of? Does your house have smoke detectors, carbon monoxide
Yeah.
detectors? Okay. Do you have any firearms or weapons in your
No.
home? Okay. And do you have any religious practices?
I go to church.
Go to church? What religion?
Christian.
would you- Okay. And are there any, what sort of cultural traditions do you celebrate?
I mean,
Any
just
specific-
the standard American holidays.
Okay, Christmas,
Yeah.
Thanksgiving, that sort of thing. Are there any cultural considerations you'd like to be taken with your healthcare?
No.
Okay. Next, we're just gonna kind of go through a whole body system review, and I'm just gonna ask you some questions about those. So in general, do you have any fever, chills, fatigue, malaise, any night sweats?
No.
Do you have any recent loss in weight, significant loss in
No.
weight? And what would you say your current weight is?
210 pounds.
And is that pretty typical,
Yeah.
average for you? Okay. Would you like to change your weight at all, or do you feel pretty comfortable where you're at?
I'm fine with it.
Good. So next we'll talk about skin. Have you had any changes in skin that you've noticed?
Mm-mm.
Any discoloration, new moles, or moles that have changed in appearance?
No.
Okay. Do you use sunscreen
Yes.
when you're out? Perfect. That's definitely something good that we can do to protect ourselves. And then any changes in the quality of your scalp, any hair on your body changes in distribution or the texture,
Nope.
okay? I see that you have glasses on. Do you have a prescription?
Mm-hmm.
And then when was your last eye exam?
It's probably been 3 years.
3 years, so 2020-ish?
Yeah.
Do you wear contacts as well, or just
No,
glasses?
just glasses.
Okay, and do you wear those when you're driving?
Mm-hmm.
Perfect. Any sort of visual disturbances, like flashing lights or double vision, blurry vision,
Nope.
no history of glaucoma or cataracts or anything like that. What about eye infections or eye pain,
Nope.
anything like that? Great. Next, we'll talk about hearing. Have you ever had any hearing loss? Any ear infections? Do you have ringing in your ears?
Mm-mm.
Dizziness? You don't use hearing aids?
Nope.
Okay. And then as far as sinuses, have you ever had a sinus infection?
Nah, not that I can think of.
No? Do you suffer from nosebleeds or frequent colds?
Nope.
Okay. Frequent nasal discharge, like runny nose?
Mm-mm.
Good. And have you had any recent colds? I know it's been kind of a tough winter.
I mean, maybe just for like a day or so. but
Okay,
no,
nothing,
No.
nothing long-term
No.
or that recurs. Perfect. When was the date of your last dental exam?
I don't know, maybe a year ago.
A year ago? Okay. Do you have any concerns with teeth? Any missing teeth? Tooth pain? Bleeding gums? Cracked teeth? Any dental appliances like dentures?
Nope.
Okay. Do you brush and floss? What would you say your brushing and flossing habits are like?
Daily.
Daily? Flossing daily too?
Mm-hmm.
Awesome. Do you have any sort of lesions or sores in your mouth or your cheeks or your tongue? Okay. Frequent sore throats? Good. Any difficulty with swallowing?
Nope.
Any voice changes?
Nope.
Hoarseness?
Mm-mm.
Nothing like that. Good. Next, we'll move to your neck. Do you have any stiffness or decreased range of motion with your neck?
Nope.
Great. Any sort of swelling. Sometimes we feel little lumps that are lymph nodes in our neck,
Mm-mm.
and then in the middle of our neck, no swelling, like where a thyroid would be.
Nope.
Perfect. No tenderness within your neck. Great. Any sort of swelling in glands underneath your armpit. That's another place where we have lymph nodes at.
Mm-mm.
No presence of lumps or swelling in your chest area. Great. Any nipple discharge at all? Good. Do you have frequent cough?
Nope.
No, and not like coughing things up on a
Nope.
daily basis. What about shortness of breath?
Nope.
No. No wheezing or weird lung sounds
Nope.
when you breathe. Do you have trouble going up a flight of stairs?
Mm-mm.
Any history of asthma,
Nope.
pneumonia,
Mm-mm.
bronchitis, emphysema? Perfect. Do you have any heart problems? Do
Nope.
you ever feel like your heart's racing or skipping a beat?
Mm-mm.
Good. You said no high blood pressure, right?
Mm-mm.
No chest pain. Good. You've never been told that you have like rheumatic disease, rheumatic fever. Good. Do you have any swelling or redness or warmth in your lower legs?
Nope.
Good. And we kind of touched on the cholesterol, so we might check that out a little bit later. Do you get frequent abdominal pain?
Nope.
Are you intolerant to any foods?
Mm-mm.
Notice any symptoms after eating? Frequent nausea, vomiting, diarrhea, anything like that? What about constipation?
No.
Okay. How often would you say your bowel movements are? Every
Couple
day?
times a day.
Couple times a day. And any concerns with like color or consistency?
Nope.
Good. Not straining to go. Have you noticed blood in your stool?
Mm-mm.
Good. No swelling in your groin area.
Mm-mm.
Perfect. Any history of ulcers or disease with your gallbladder?
Nope.
Good. Next, we're going to move to the urinary system. Do you have any pain or frequent urination?
Mm-mm.
No pain along your back? Any sort of history with kidney stones?
Yeah, I've had kidney stones before.
When would you say the last time you dealt with that?
It was like 15 years ago.
Okay, so it's been a while. No blood in your urine,
Mm-mm.
no problems with having to go to the bathroom all the time or having to go at night, waking up at night frequently. Good. No sexually transmitted diseases, any UTIs ever?
Mm-mm.
Do you have any discharge?
No.
Perfect. And do you ever perform a self-evaluation for testicular cancer?
Mm-hmm.
Okay. Are you still wanting to have more children?
No.
And you did say you had a vasectomy, so using that for contraceptive. Have you ever had a prostate exam?
Mm-mm.
Okay, maybe that's something we could look into. And then we'll talk about sexual history. Are you currently sexually active?
Mm-hmm.
And how many partners?
One.
One. And what about past partners?
What's just like a number?
Yeah.
This couple?
Okay. No concerns with that at all.
No.
Okay. And what about pain or stiffness? Any pain or stiffness in your joints or your back?
Mm-mm.
Good. Any limited range of motion? Would you say you have any problems with walking or posture?
No.
Okay. What about swelling or weakness?
Nope.
Okay. Any history with head injury,
Mm-mm.
loss of consciousness?
Mm-mm.
Good. Dizziness, numbness, slurred speech, none of those things.
Nope.
How about seizures, memory impairment? Good. Do you have any concerns with anemia? That's when your hemoglobin is low. Okay. No concerns with sickle cell disease or sickle cell trait. No history of bleeding disorders. Good.
Mm-mm.
And then you said no history of thyroid disease for yourself or your family.
Mm-mm.
You don't find that you have intolerance to heat or cold.
No.
Okay. And then what about excessive hunger, thirst, or urination? Those are signs we look for diabetes. Great. Are there any final questions that you have for me or anything you think we didn't cover?
Nope.
Perfect. All right. So this part of the exam is complete. Thanks.
Thank you.